Hi there, welcome to part two of what you can expect when you're going through what they call the healing crisis. So, this is really, 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 really super important stuff. The reason why, think about it this way: if you're going to have a surgery, let's say you have a problem with your heart, you have a problem with the heart valve, maybe it's um, a genetic defect, you have a heart valve defect, and now you need to have, maybe it only affects people once they get to be about 40, and now you're around 40 and you need to have this surgical procedure done on the heart. If you look at the ultrasound and the studies of the heart before the procedure is done, you can see that there's this defect. And then if you look at the heart after the procedure is done and healed up a little bit, you can see that there's no longer the defect. So that's pretty much black and white. I mean, you can tell, when healing, the process of healing took place after the surgery, because, there's a difference in the anatomical structures there. The actual anatomy, the heart valve itself, is now completely changed. And that can also happen with holistic therapies. But don't forget, it's a little bit less of a definite step-by-step process. And the step-by-step process is completely different. So, for example, people who tend to have digestive difficulties, like let's say they have too much diarrhea or too many loose stools, too many loose bowel movements, when they have a really amazing healing take place, after that healing process, they tend to have, or I should say, after that healing intervention takes place, right away, they'll tend to have more diarrhea or even more loose stools, because now their body is aware of what they're trying to get rid of, and it really starts to release those poisons and toxins. People who have a little bit of trouble with their skin, such as, eczema or psoriasis, or dermatitis piliformis or some other skin conditions, they'll tend to, even acne as an example, they'll tend to have more psoriasis after really good holistic treatment. They'll tend to have more eczema. They'll tend to have more dermatitis piliformis, even acne. They tend to break out more. And of course, there are ways to prevent that healing crisis from getting so severe. And luckily, we help people with that through our office, Triad Family Healing Center, and myself. By the way, I'm Dr. Ilya Skolnikov. I'm the clinic director at Triad Family Healing Center. So, people who tend to have headaches may have worse headaches after they have a really effective therapeutic treatment that uses holistic therapies like herbs, homeopathy, nutrition, chiropractic, energy medicine, flower essences, and other holistic therapies like emotional therapies, therapies that involve spagyrics and gemotherapy, lithotherapy. Some homotoxicology could be either conventional medicine, helping a person to detoxify from drugs in a hospital-like or clinical setting, or it could be in a holistic environment where we're helping the person to release chemical burdens that come from medications, that come from heavy metal toxicity, that come from exogenous hormones, hormones that are applied to the skin and that are coming in from out of the body to into the body. Or there's all these chemical residues that can build up. The point that I'm getting here is that from a medical standpoint, we'll expect, or at least from a conventional medical standpoint, we expect to look at things as like black and white. But from a holistic standpoint, you'd be surprised how often we do look at things as black and white, but our patients aren't aware of that. They think that they're supposed to feel better. So think about how big of a deal this is. You're setting yourself up for absolute failure if you think you're going to do much better after effective holistic treatment rather than worse, when what we're really expecting is for things to get worse. People who experience or have experienced depression in their lifetime, especially when the most common cause, which the most common cause is, if the most common cause is due to a toxic liver and gallbladder and colon, which usually is the case with most depression, there's lots of exceptions, but it's really almost always the case. They've also had a lot of trauma throughout life, in childhood and adulthood and whatnot. Women and men tend to be victims of both physical and mental abuse. But regardless, after really, really effective holistic therapy, the person would expect to have more depression if their main symptom that they experience is depression. A person who has headaches, now that their body is releasing more poisons and toxins, would expect to have more headaches after a really good, effective, holistic treatment. And that makes sense. However, if they integrate the holistic lifestyle change therapies, which would include drinking more water and eating different foods, changing their diet quite a bit, that would allow a lot of these poisons and toxins to be released from the body more easily. That would prevent such a headache from taking place. So one needs to really understand a little bit about what's going on when they undergo holistic therapies. Again, if you're expecting to get rid of depression and if you've had depression for many years and now let's say you're decreasing an antidepressant, one wouldn't want to be shocked and surprised if all of a sudden they have more depression. And again, thank goodness that, with the Triad of Health, vibrational biodynamic assessment and treatment system, we integrate lifestyle changes into the process, such as how much water to drink, how much protein to eat, how often to eat, how large of a protein meal to eat, how much sun to get, how much exercise to get or not to get, how much sleep to get at night, whether or not you need to get a new pair of eyeglasses, a new eyeglasses prescription, whether or not you need to go to a dentist to get some procedure done there, whether or not you need massage, whether or not you need colonics, whether or not you need to go to another type of healthcare provider of some sort or another. And these are all really important things, because let's say the person's going to expect to be really, really depressed if they don't get regular sunlight. But if they do get regular sun 3 or 4 days a week for a half hour or more, which is different than what we're being told. We're being told that sun causes skin cancer, which is absolutely ridiculous, because the sun brings life. In fact, for plant material, for plant organisms, they can't grow and they'll often wither and die when they don't have enough sun. And the same thing goes with most mammals. When you get sun, that's what allows you to create vitamin D in your body. And the vitamin D allows you to have a healthier hormonal system. It actually is a hormone. It's a sterol substance similar to cholesterol. And the vitamin D allows for strong, healthy bones and to some extent joints, but mainly the bones. It allows for proper, healthy calcium metabolism. It's been, like I just said, I'm repeating myself, but it's been linked to improved immune system function. So it's really pretty crucial, okay? Yeah, very important. All right, good. So I hope you liked part 2 here of the healing crisis, what to expect, the Hertzheimer reaction, the homeopathic aggravation, what's really involved. Remember, we're preventing surgeries. We're preventing you from having to spend hundreds of thousands of dollars in the last few years of your life dealing with health issues that you can now prevent by just spending a little bit more money throughout the course of your life, and then having more health, vitality, a higher quality of life, a greater experience of life, more options in life. I can't tell you how shocked I am just to see in the last 10 or 15 or 20 years or so how many more people are not even ambulatory. They're going around in wheelchairs nowadays. It used to be that, you'd see a person in a wheelchair every now and then, but we're just seeing, almost every time I go to the airport, I'm seeing, I don't know, maybe you know, a good 6 or 7% of people, maybe a little less than that, are going around in wheelchairs, just because people have become quite a bit less healthy. Thanks for tuning in. Please share this with somebody that you know. If you're seeing it on Facebook, definitely give us a heart, or the other thing, there's a heart. You could also give us a smiley face or give us a surprised face. But yeah, definitely share it with somebody that you know that you think could benefit. And yeah, we'll look forward to seeing you at the next video. Okay, thank you so much for joining in. Really, really appreciate your support. Talk to you soon.